In this video, we'll discuss about parotidectomy. This is treatment options for tumors involving the parotid gland. That could be pleomorphic adenoma or mucoepidermoid carcinoma or adenoid cystic carcinoma, like that, any tumor. In UG level, that is for your final BDS exam, the question will not be asked like write about parotidectomy. The question will be asked as pleomorphic adenoma or based on specific tumor. But in the treatment aspect, you have to write the parotidectomy. So, if you understand and if you able to learn these diagrams, you can write these diagrams for any specific tumor answer involving the parotid gland. So, that is the importance of this one. So, in parotidectomy, there are three types, especially superficial parotidectomy and total parotidectomy and radical parotidectomy, right? Superficial is nothing but removal of the superficial lobe of the parotid gland. You know this, there is two lobes in the parotid gland, superficial lobe and deep lobe connected by the isthmus, right? So superficial parotidectomy is nothing but removal of the superficial lobe, and total parotidectomy is nothing but removal of the complete two lobes of the parotid gland, that is complete removal of the parotid gland. Right? In superficial parotidectomy also, there is something called as partial superficial parotidectomy. That is removal of the only tumor mass along with normal glandular tissue. Right? Some normal glandular tissue surrounding that tumor mass. That is called as partial superficial parotidectomy. Radical parotidectomy is nothing but removal of complete parotid gland along with the facial nerve. Right? So, superficial parotidectomy is the option that is indicated in cases of tumors involving the superficial lobe of the parotid gland. Right? And total parotidectomy is the option for tumors involving deep lobe. Right? Deep lobe of the parotid gland as well as the dumbbell tumors. Dumbbell tumors are nothing but deep lobe of the parotid gland tumors extending to the lateral pharyngeal space. In those cases, total parotidectomy is indicated. And the radical parotidectomy is indicated in cases of malignant tumors, especially the tumors which shows perineural invasion. For example, adenoid cystic carcinoma. In that case, there is a perineural invasion. That means, if there is facial nerve weakness characterized by the paralysis, in those cases, you can go for radical parotidectomy. That is complete removal of the parotid gland along with the facial nerve. These are the types of the parotidectomy and their indications. Right? So, now we will discuss the step-by-step surgical procedure. This is the flowchart for step-by-step surgical procedure. You have to do it under general anesthesia, and after that, you have to mark the skin incision, infiltrate the local anesthesia, right, for bleeding controlling purpose. You have to infiltrate only in the skin incision marking region, not in the entire region, because that local anesthesia may obstruct the intraoperative monitoring of the facial nerve. That is why you should only inject in the area of skin incision and wait for 3 to 4 minutes or 3 to 5 minutes, right? After that, you have to incise the skin along your marking, right? Skin incision for parotidectomy starts in the hairline, right? And in the hairline, and it runs downwards and backwards to the junction of the pinna and temple region, right? From this, it will run preauricularly, right? And it will go around the attachment of the lobe like this, and it is extended downward in a skin crease. So this is the marking, right? After that, you have to raise the skin flap. You have to elevate the skin flap. Take care not to buttonhole it. That is, not to puncture the skin. And after elevating skin flap, you can expose the parotid, right? So our area of interest is only this region, in the parotid region. That is why from these diagrams we will draw only the parotid tissue, right? So parotid gland is exposed after exposure of the skin flap, and first when you are dissecting the when you are starting the surgery, first you have to free the tail of the parotid gland. Tail is nothing but the inferior end of the parotid gland, right? First you have to free this region. In this case, this green colored one is nothing but the parotid gland. So you have to first free the tail of the inferior end of the parotid gland, right, from the surrounding landmarks. We have already discussed how to identify the facial trunk. That is landmarks for the facial trunk identification. You have to identify all those things. At the tail, you have to separate the parotid gland from the posterior belly of digastric, sternocleidomastoid muscles, all those structures, right? So after freeing the tail, the next step, the most important thing is nothing but the identification of the main trunk of the facial nerve. We have discussed that in separate video. Please watch that, right? Based on those landmarks, first we have to identify the main trunk of the facial nerve. This red colored one is nothing but the facial nerve and green colored one is nothing but the parotid gland. So this is the main trunk of the facial nerve. We have to identify that, right? And after identifying, you have to dissect it. Dissect its branches, right? You have to dissect. Now dissection should be done to identify all the branches, right, in the plane of the facial nerve. And after nerve dissection, you have to remove the salivary tissue, superficial, to the facial nerve, right? So I already told, facial nerve travels between the superficial lobe and deep lobe. It doesn't enter the substance of the parotid gland, right? That means the salivary tissue superficial to the facial nerve is the superficial lobe and deep to the facial nerve is nothing but the deep lobe, right? So when you identify all the branches of the facial nerve, the tissue, salivary tissue superficial to that will be removed. That is the superficial lobe, right? So in this case, this is the diagram. These are the simplest diagram, I think so. You have to hold the salivary tissue with a retractor. This black color one is nothing but the tissue holding forceps, and you have to dissect with the scissor. This is the scissor. You can use curved mosquito forceps, right, to dissect this one. And this is the picture after the dissection, right? So these all are the red colored one all are the facial nerve branches, and this is the superficial salivary tissue dissected, and this is the retractor, your forceps, tooth holding forceps, right, tissue holding forceps, and this is the parotid duct. When you identify the parotid duct, you have to ligate it and cut it, right? So until this step is the superficial parotidectomy, right? Once you identify the parotid duct, you have to ligate that and cut that, and you will remove this superficial lobe, and this one is nothing but the deep lobe of the parotid gland, right? So you have to remove this one, superficial lobe. That is the superficial parotidectomy. That is indicated tumors involving the superficial lobe only, right? So if you are planning for total parotidectomy, the procedure is same till now, right? You have to remove the superficial lobe. After that, you have to retract the facial nerve branches. You have to retract the facial nerve branches, and you can easily access the deep lobe. In some cases, it may be required to go for mandibulotomy, right? That is sectioning of the mandibular ramus to gain access to the deep lobe, right? In this diagram, you can see here, this black color one nothing but the retractors retracting the facial nerve branches so that you can gain access to the deep lobe, right? And you have to hold with a tissue holding forceps the deep lobe, and you have to completely pull it out by freeing the facial nerve branches, right? So this is the total parotidectomy. In radical parotidectomy, simply you have to remove the facial nerve branches also, right? That is the radical parotidectomy. And after that, you have to Again, hemostasis, that means you have to control the bleeding and you have to place a drain. Right? Drain should be there for 24 to 48 hours. That is for collection of the fluid after the surgery to prevent the hematoma formation. Right? This drain can be placed with a separate stab incision of the skin. Right? And after that you have to close up the wound. You have to provide 2 layers closure. You have to close subcutaneous tissue as well as the skin, right? That is 2 layers. This is about the surgical procedure of the parotidectomy, and you have to draw these diagrams. Simple one, right? In complications, we have hematoma. This is mainly due to the failure to achieve hemostasis before the closure. Some surgeons prefer hypotensive anesthesia so that bleeding can be easily controlled during the surgery. So if hypotensive anesthesia is used before closure, the patient should be made normotensive and all the bleeding points should be controlled. After that only you have to go for sutures, right? If there is hematoma formation, you have to reopen it and evacuate the hematoma and control the hemostasis, right? Control the bleeding, and you have to close the sutures, right? And infection. If infection is there, then you have to use the prophylactic antibiotics. Facial nerve pulse. This is mainly due to the neuropraxia, due to stretching of the facial nerve branches during the surgery. And one more important thing is devascularization of the facial nerve. Due to the superficial lobe removal, the nerve will become devascularized and it may result in some form of facial nerve pulse. If facial nerve palsy occurs, then you have to tape the eyelid and you have to protect the eyelid also. And you can go for temporary tarsorrhaphy when you are doing the surgery also, right? Then salivary fistula. Salivary fistula is nothing but when you remove the sutures, there will be saliva leaking along the suture lines, right? Salivary fistulas can be easily treated with pressure dressings, or you can go for anticholinergic drugs also, like glycopyrrolate, scopolamine, to reduce this salivary secretion, right? And gustatory sweating. Gustatory sweating are also called as auriculotemporal syndrome or Fraze syndrome, right? This is nothing but localized sweating in front of the ear when the patient is chewing, right? That is especially occurs after the parotid surgery, and this is very much important topic we will discuss in a separate video. And cosmetic deformity due to the removal of the complete salivary gland. Cosmetic deformity can be treated with sternocleidomastoid flap. So these are all the complications of parotidectomy. If you like this video, hit the like button, share the video, subscribe the channel.